This morning, as I mentioned, from San Juan Regional Medical Center. Welcome to KSJE. Rachel Timmerman is here. She is the Patient Experience Manager at the hospital. Good morning. Thank you for coming in this morning.
Good morning. Thank you for having me, Scott.
You bet. Good to have you back. Melanie Stout is also here this morning as well. Melanie, good morning to you. You are the manager of the Professional Resource Team, Outpatient Nursing Clinic, and a lot of other things that I don't even have room to fit on the screen. But good morning to you.
Yes.
Good to have both of you here. You are both here to talk with me a little bit about this new patient experience program at the hospital. And so, Melanie, can we start with you a little bit about some history behind this whole concept and how it came to be?
Yes, absolutely. Thanks for having us.
You bet.
We actually wanted to create a patient experience program, and this has been a long time in the making. That was homegrown, almost made with caregivers' input, having a core team that was made up of all types of frontline caregivers. So when we think about taking care of patients, it's not just direct frontline, right? Nurses, patient care techs, providers. It is all the departments that go into taking care of our patients. So everyone is a caregiver. We wanted to really emphasize that and create a patient experience program that was pretty sustainable. We found the What Matters to You program that kind of encompassed all of those things that we wanted.
And this is something that is being done in other hospitals around the country? Is it somewhat unique to San Juan Regional? I mean, it hasn't been around forever, right? This is a relatively recent?
Relatively recent. I think all healthcare organizations want to create something that really speaks to who we take care of. Patient experience is huge. How do you define that? All of those different things. Again, we wanted to create something that was homegrown, that really helps our community. And then the What Matters to You program has been around for just a bit. I think Rachel can kind of speak to that.
All right, let's move to Rachel and ask about this. The name of the program is What Matters to You, right? And that is kind of what you are implementing and is being implemented at the hospital these days.
That is correct, Scott. So What Matters to You is an international program. We took concepts from that program and we really looked at it and thought, how can we apply this to our community, to our organization? Because truly what matters to us really does, matter in what we do. It's finding our purpose. And if caregivers know their why are they here, they'll know their way and they'll deliver that care to the patients that they're looking for. We really want to have meaningful conversations with our patients, and it's really about building relationships and foundations on how to build those relationships and understanding cultural humility and spiritual distress. And our patients come to us when they need us, when they're scared, and we have to be there for them at every touch point, as Melanie talked about.
And to me, it seems like, when we go to the hospital, you're right. People are not, maybe they're not feeling very well. They're maybe scared, as you mentioned, and things along that line. And so we go to the hospital to get better, and that's kind of the base point, right? And then this kind of builds on that by receiving care and how the employees interact with the patients and to keep some of those things in mind, I guess, when they are interacting with the patients. Is that kind of the next higher level, maybe a little higher level thinking of other interactions? Is that where we are?
Yeah, absolutely. Every single employee went through this program, and whatever that employee's role is, it has a ripple effect on the patient. And it was really helping them understand that what they do really does affect the person that's needing our help. And we want to be there for them. And so we all need to understand that concept, that our patients, if we ask them what matters to them and really have that crucial conversation with them, we're going to be able to meet their needs at their level. And if we don't ask, we won't know what that level is.
Right. And you said every employee has gone through this. So that includes the employees that maybe don't ever see a patient or maybe come into contact with a patient or very rarely come into contact with a patient. I'm thinking custodial or folks maybe in the gift market or things like that.
Well, yeah. I mean, our sterile processing unit, the team that's back there reprocessing equipment, or, our grounds team from our finance department that are maybe in insurance and referrals, every one of us have a responsibility. And really, it's not just, if we don't have that patient care interaction, we have our caregiver to caregiver interaction. And, speaking to somebody, our tone of voice, if we don't know who we're talking to, if we're not introducing ourselves, if we're not letting them know that they can trust us with what they're asking us to do and that we're going to deliver, we're not going to have those meaningful relationships with each other.
Got you. And so this is then obviously all encompassing, it sounds like to me, what you hope it to be, right?
Right, and I like that we started. We accomplished this task by starting off asking everyone, what does patient experience mean to you? So Scott, what does patient experience mean to you? How would you define that?
Right. If I'm a patient,
If you're a patient, how
Yeah.
would you, if you've ever been a patient, how would you define patient experience?
I guess, getting all my questions answered in a relatively quick amount of time.
Right.
Because I think maybe sometimes folks don't know the right away,
Yeah.
but maybe can get back to me, and, knowing that I'm going to receive the care that I am going to the hospital for.
That's great.
And,
That's
and
great.
get feeling better.
Yeah.
Whatever is ailing me, and there are many things, but
Yes.
the show's not long enough, so I won't go into that. But that's what it means to me, and I'm sure it means different things to different people depending on what brings them to the hospital.
Absolutely, and it was interesting to have those conversations in the group and hear everybody's definition
Sure.
of patient experience. So then we took that, because maybe some of us have been patients and our loved ones have been patients, and what were our expectations, and then turning that around and saying, okay, that's what you expected. Are we actually delivering that? We see patients at a window, right? We don't know what's going on in their lives, and we want to really take that into consideration. So how the patient defines it, how San Juan Regional defines patient experience, and then how our community would define patient experience, because we're here to serve our community.
Right. Very good. I want to ask you both a bit about more of the logistics involved in this and how everybody got introduced to this program. Take me through some of the training, some of the steps.
Well, as Melanie mentioned, we had a core team, and this core team was years in the making. COVID did halt us a little bit because we wanted it to be very interactive. Once we were able to have restrictions lifted, we hit the ground running. We're very thankful that the college offered us some rooms, and we utilized the campus to teach 50 caregivers in the morning and 50 caregivers in the afternoon over a two-month time span.
Wow.
We created escape rooms, and we had our caregivers run through those escape rooms. And I'll let Melanie talk a little bit about those escape rooms.
What did that entail?
Oh, wow. So
Sometimes I feel trapped up here. I work here, but that's a whole different story too.
We had the help of some of the nursing professional development teams, so they utilize escape rooms for like trauma conferences and different things, and it's a great learning tool. So apprehension from some caregivers, like, I've never done this, is there a test? We did some cornhole stuff, but one of the scenarios that we created were based off something that happens, lost valuables and belongings. We have a process to keep those safe. What happens if that process isn't followed? And these things are very important to our patients. So that was the scenario, and we had to find the necklace that we had kept safe for one of our patients. So it was kind of cool, the puzzles and everything that they went through. Plus, if you think about, you've got finance and housekeeping and nursing and all these different departments working together, getting to know one another, that was where the connection happened. So,
Right. And so you mixed them up a little bit. It wasn't
Yeah.
just departmental that you brought in.
Absolutely.
At the same time. You had bits and pieces or people from different departments, I suppose.
Yes.
Going through all this.
Yeah, we wanted to keep our groups small. That was really important because we knew that we needed to build that connection. This is a long-lasting program. It is taught once a month to all our new caregivers that are coming into our organization. We have also created booklets that we're giving to our patients to help stimulate the conversation with our patients, because sometimes they're not sure why we're asking that. And at the end of the day, it's because we truly care, and we really do want to help them, and we want to live out our purpose. We want to be better. Giving tools to help not only our caregivers but our patients to engage with us and to partner in their healthcare journey.
Yeah.
Right. Got it. And when you talk about caregivers, you're talking about everybody at the hospital, correct? I mean, that's a term that you're using to describe the groundskeepers and the custodial folks and everybody, right? Not just the direct patient-connected employees.
That is correct. From marketing to grounds to custodial to dietary to finance to nursing. Our physicians were putting a program together for them So they understand and they can ask and feel included in this journey with us, asking our patients what matters to them.
Right. And let me ask you both about physicians and the medical staff, because many times we hear that, those medical professionals are really busy. They don't have a lot of extra time. And so when you have a moment to connect to a doctor and can ask them questions, but their time is pretty valuable, obviously. And so is there some techniques in there to help with their interactions with patients as well, to try to make that meaningful even in that short amount of time that they maybe have with a patient?
Well, honestly, it only takes 90 seconds, right?
Yeah.
When you ask a patient what matters to them, they will tell you. There's been a lot of studies and research done, and it will give a physician the opportunity to give that personalized care. That's what they want to do. And so finding the time to deliver this information to them is going to be a challenge, but we're ready for that challenge. We did it for 1,300 caregivers.
Right.
And so we're willing to take on this challenge.
I also think that we've seen this concept in working at the hospital. I have, for example, in the inpatient setting, we have those whiteboards. We're going to start putting on our whiteboards, what matters to you matters to us. So it's that reminder, right? But before this program, I've been in rooms where providers have talked to the patient about surgery, but really maybe the patient is just worried about the cat at home that
Right.
Nobody can care for, right? In our mind, it's like, I want you to be prepared for your surgery and after, but the cat is important to her. So listening to that takes just a little bit of time. You know what? Let me see if I can get somebody to help go over and check on her, whatever that might look
Sure.
like. Acknowledging that was important to her and then going on with the surgery. So then you're connecting with your patient, right? So,
Right. And they maybe feel more comfortable
Absolutely.
before surgery, right? Which hopefully helps with the healing process and everything
Absolutely.
else, right? As they want to get home to the cat and continue their recovery and what have you. But it's interesting to me because the way that question is phrased, it sounds like it's by design and thoughtful to elicit a response from the patient in that short amount of time. And that's kind of what you were talking about, is at 90 seconds and you can learn a lot maybe in that interaction about what is going on in that patient's mind.
I think, anxiety, we have to remember anxiety is suffering, and we don't want our patients to suffer. So, just taking the time and just really building that relationship, it's crucial.
Right. And go ahead.
Oh, sorry.
No,
I
that's
think
okay.
one of the biggest things, and Rachel just made me think of it, is the perception piece. I may think that something is going on, and even with each other, working interdepartmentally, I may think something is going on, but when we really take the time to listen, it may not be anything that I've thought. And when it is in those occasions, up more than 90 seconds, giving tools to caregivers to say, you know what, give me 1 second. I'd love to hear about that recipe
Right.
or whatever it might be, right?
Sure.
Like, I will come back in just a bit. So giving caregivers tools to kind of say, hey, I'm going to go do this really quick, and then I'll come back and I'd love to hear more. So, yeah, I think that perception and connection is a big thing.
Right. Very true. Let me ask you both a bit too about maybe family members. Is this something that can help family members as well, in addition to the patient, to maybe understand what's going on with their care and things along that line? Does it extend beyond the patient to maybe home caregivers and other family members too?
Thank you for bringing that up, because we did talk about this in our courses. We talked about how sometimes our patients may not be able to tell us what matters to them. So it's important that we pull our family in or their caretakers. And we have to utilize all those resources, because we don't know what that home environment looks like. As Melanie said, we have a window of time. We don't have the whole opportunity. So we just really need to try to understand and use other people that are available to help us understand what's important to the patient.
Got you. And that may include a family member or others in that. And that includes, I imagine, kids as well as the very young, very old.
I love talking about the kids. The pediatric
Right.
unit is the other unit I
Yes,
manage, and
right.
we love caring for our littles. But yes, man, they've got things to say, and it is the most beautiful thing when you have interactions with all types of family members. So yeah,
Right.
they are just as important.
And if they can't maybe verbalize as well as maybe an adult what matters to them, is there a way to maybe interpret what they're telling you or how they're looking when they're talking to you?
Oh
Or?
gosh, yes, depending on the developmental age
Sure.
of your patient, and then just watching the interactions with the family members, getting a good history, connecting with your family, your moms and dads, grandmothers that might be raising their kids, connecting with them so that they do open up to you, so you can address all of their needs. So yeah.
Right. But then the program works the same way with a young patient as it would work with an older patient, I would suppose, right? It's kind of designed that way.
Yeah, absolutely. Sometimes we do have those, we talked about also like being tuned into body language. And, when we have to wear our masks, we lose a little bit of that facial expression. So we talked about when somebody smiles, you get to see their smile wrinkles. Melanie does something very often, and she puts her hand on her heart when she's speaking to somebody, and that's a sign of compassion. Those actions are huge, right? And we talked about how important that is. Not only that are we, delivering body language, but how are we receiving another person's body language and how to understand that and interpret that.
Right. Well, and you would think after living through the pandemic, when we couldn't see people's faces or smiles, that we may have learned a little bit about that, and we could to a certain degree. But that's really important to remember in a hospital setting, that you're still wearing masks, and it's still harder maybe to see people's facial expressions when they're doing that. But that's really important. What am I forgetting to ask you both about with this program? As you mentioned, it is relatively new and it's ongoing. So any new employee is going to get onboarded with the same type of training, correct?
That is correct. It's very standardized. We kept the escape room. Next year in June, we'll be celebrating What Matters to You. There's an international day every year in June. So we will be definitely celebrating and coming up with some great ideas. We're working on those right now, so we're prepared.
Very good.
I think we talked a little bit about incorporating some other caregivers that have gone through the class that are excited to teach. So sort of coming up with a process for that so that they can be involved, maybe facilitating escape rooms. They're excited about it and they want to help. So that's the exciting thing. Some of the feedback that we received from the class was just, you know what, I was pleasantly surprised. Thank you for resetting my button. Thank you for helping me realize what other departments go through. You know what I mean? We really want to take that view everywhere. So yeah, I was excited about that.
We did get an overwhelming positive response from our caregivers at the organization, which made us excited because it let us know how important this is and what it means to them. And they're excited to share it with our community. And honestly, I went to a lot of the clinics yesterday, and the caregivers at the front desk are handing out the What Matters to You booklets to the patients, where patients can just write down their questions and what really does matter to them. And when they get there to see the doctor, things are streamlined. Questions aren't forgotten. So I hope to see those books continually used and meeting the needs of our patients.
Nice, very good. And do you think, for both of you, this question, do you think coming out of COVID, when we heard just how long hours and short staff and things all of our healthcare workers seem to be experiencing during that whole time, that this is an important kind of a reset for some of them, as you mentioned, resetting the buttons and just kind of rethinking why am I in this job? Why did I get into this line of work, kind of a thing, to help people and to provide care and all those different types of things that maybe during just the pace of the pandemic maybe got put aside because we just had to get people better. I don't know.
That's a really good point you bring up, because we start the actual program talking about asking them what matters to them. And a lot of times it was all of those things that you just said. And then we brought to the table, look at the things we're working on. It takes time to recuperate from all of those things. Our community had some unique challenges that other healthcare organizations may not have had. So I think looking at how we bonded together, even just recently, some of the community tragedy that we've had,
Sure.
The way we all rallied together really spoke to that. So, and we were still doing classes when all of that happened. So the way that people talked about it, like I'm connected. This is a community within a community. So getting them excited about that. So yeah, that's something we did discuss.
Right. Very good. Well, glad to hear about it. And so we just have a couple of minutes remaining this morning. And so again, moving forward, this will continue at the hospital. You'll be looking at ways maybe to build on this program too as it goes forward.
Absolutely. Like I said, we will be doing a big celebration next June, and how to incorporate that. We use it in our everyday language. When we close emails, thank you for trusting me with this project. We say that to our patients. Thank you for trusting me with your care. That is huge. And it's really, as a caregiver, as a nurse myself, when a patient says, you know what, thank you, it just really makes me feel like, man, I made a difference in somebody's life. And that's so important to me. That's why I'm here. I want to serve our community.
And she does, definitely. I could not have done this without her.
Wonderful.
I was excited to get this started, and like she said, COVID, kind of put a stop to things, but it was amazing to have somebody pick it up with the same amount of passion. So
very
awesome.
Good. Well, it didn't stop at maybe a pause, but not a
Yeah,
stop,
yeah.
because it's back. And
Exactly.
Full speed ahead, it sounds like to me. So
Yeah.
wonderful. Well, thank you both very much for coming in and talking with me about this program this morning, the What Matters to You Patient Experience Program at San Juan Regional Medical Center. Thank you both.
Thank you.